Hey, my name is Nicole Cobb. I'm an occupational therapist with health-related home care. I have about 10 years of experience in occupational therapy, with 8 of them being specific to home health. Wanted to come to you today to teach you how to use what is called a hip kit. We use these for a variety of patients, specifically for patients who have had hip replacements, as they cannot bend past 90, which means you in sitting can touch your knees, and in standing you can touch your knees. You cannot reach beyond that, otherwise you break your 90 degrees. You also have to keep your foot straight or out. You cannot internally rotate or cross over. Main concern with that is that it does make it very difficult for you to get dressed without breaking precautions. So we use this hip kit to make sure we follow those. We also use them for back patients. Back patients have to keep their backs straight. Again, if they don't have the flexibility to cross up and keep their back straight, the hip kit comes in handy. You also have patients who just cannot reach their feet for one reason or another. Osteoarthritis in their hips, their knees, ankles, etc. Can't do proper dressing. So this makes you independent. First, I'm going to show you how to use a reacher. This is a wonderful tool. You can use it for a variety of things, including picking up things off the floor. But for dressing specifically, what you're going to do is you're going to use this blunt tip screw here. You're going to rotate your foot slightly out. You will then push at the heel, and I highly recommend the heel because it comes off much easier and quicker. You push that off and your shoe comes directly off. Again, you can use this to take your sock off. You will again push at your heel, pushing down and off. You can use the gripper portion as well. I will show you that. You will take this, grab a piece of your sock, pinch down, and you can push off your sock like that. The next thing I'm going to show you is how to put on pants. I'm going to go ahead and take my sock and my shoe off. With your pants, what you're going to do is you can do one of two things. You can grab your waistband, throw it on the floor, and start that way. Or you can just take them in your hand, get them situated, front, back, throw it on the floor, and go that way. Once you've got that done, you're going to take your front part of your band. You're going to slide that foot in, recommending the one with the least mobility first, or the surgical leg, whichever one you want to call it. You're going to pull up over your foot. Sorry. Then what you'll do is you're going to take that down. Again, grab your reacher, push that down till you can lift that foot, put the other side in. And once it's at your knee, you can definitely go ahead and grab it with your hands. That'll make it a lot easier. You will pull straight up, and then of course you can stand up, pull over your hips. Taking them off, you will push down over your hips, sit down, they'll be down at your knees. You'll again take your reacher, you'll push down. I like to grab towards the middle, and you just kind of push, removing your most flexible leg first, and then of course your surgical leg, and then those are off. The second piece of equipment is, of course, your sock aid. This is a wonderful tool. What you will do, the way it's going to work is the bottom of your foot is going to be on the plastic portion while the top is exposed. You'll take it, and what I like to do just to free up both hands is kind of push it against your belly. You will then take your sock, load it completely on, pulling it all the way so the tip is completely on. If you leave it like that, that's how the sock's going to come on, which is going to make it harder for you to get it all the way up. So again, pull it all the way to the tip. You're going to take your straps, throw it on the floor, and then you're going to wiggle your foot in. And this can be driven, so if you don't get it in the right place, you can pull it and tug it as you need to. You're going to slide your foot in, and what I like to do is kind of get that foot in as much as you can before you start pulling. Point your toes down, and you're going to pull up towards your hip, and now you have on your sock. With your shoe, you will have your reacher and your shoe horn. What I like to do is take my reacher and hold the tongue of the shoe out of the way. You can also take it, kind of pull it like this. Now, You will at this point in time have replaced your regular shoelaces with elastic shoelaces. Those you just thread in, tie off, and it will essentially make what is a tennis shoe a slip-on shoe. So again, you'll take the reacher holding the tongue of your shoe. That point in time, what I like to do is go ahead and kind of get that shoehorn started. I'm going to try to expose as much of that entrance of the shoe as I can, but this allows me to, one, slip my foot in, again holding tight to the tongue of the shoe, and I slide my heel down that shoehorn and your shoe is on. The last piece of equipment that you'll get in the hip kit is, of course, your long handle bath sponge. This allows you, one, to wash your back, but two, specifically to wash the lower part of your legs. You can kind of get around completely that way. One of the things I like to tell patients, if you don't feel like you're getting the bottom of your foot very well, you just kind of push it up against the floor of the tub and swipe your foot in that direction. And then you've got that complete. And that basically concludes your hip kit and training on how to use each piece. Thank you.